Now, Tamil Nadu becomes the second state after Maharashtra to cross the grim milestone of 1 lakh cases, with Chennai alone recording 65,000 cases. The health department officials in the state say that the high case load is a result of Tamil Nadu's strategy of aggressive and increased testing to reduce the state's fatalities. As of yesterday, over 12 lakh people have been tested across 91 testing facilities, which is the highest rate in the country. Between the 19th of June and the 30th of June, when the state announced a hard lockdown in Chennai, Kanchipuram, Tiruvallur and Chengalpattu, over 3 lakh people were tested across the state. Since the 20th of June, there's been a spike in testing with over 30,000 people tested every day on average. Chennai is seeing a steady surge in COVID-19 cases as testing intensifies, but there is a silver lining in North Chennai, where active cases have fallen and recoveries are on the rise, especially in the high-risk areas of Tondiarapet and Royapuram. Purnima Mulli reports on the COVID strategy here.
Narrow lanes, dusty alleys, cramped houses, jostling crowds at every corner. This is the scene across North Chennai, where a teeming mass of working-class residents grapple with a spike in COVID-19 cases. 2 of Chennai's 6 risk zones are here. Tondiarpet and Royapuram have contributed to more than 15,000 cases.
We are at a marketplace in Tondiarpet, one of the zones where the spike has been consistent. You can see this particular market, not many people here are wearing masks, whether it's people who are buying vegetables or fruits or flowers or the ones who are selling. And social distancing norms are also violated. These are the 2 reasons why the state government says that it has been a challenge to contain the spread of the virus in places like Tondiarpet.
The sheer lack of space makes it difficult to enforce physical distancing.
The mask wearing has improved to a great extent. Around 65 to 70% observation is definitely there. The challenge still lies in the social distancing. You know, our country's population and the city's density. We are working out continuously on that from various angles. I'm sure in the coming days we will be giving much more better results.
Authorities focused on intensified testing and on hotspots and slum areas. That seems to be working, and discharge of recovered patients has picked up.
We have rolled out the Chennai Community Intervention Program in association with 93 NGOs. The zones 4 and 5, which were once, the hotspots 2 months back, particularly from the densely populated slum areas, there were lots of cases. Now, in this zone where we are standing, out of the overall cases, roughly around 9 to 10% of the cases only are from these densely settled pockets.
The active cases in Tondiarpet and Royapuram appear to be plateauing over the last few weeks as compared to other city areas such as Annanagar and Kodambakam. The high death toll is still worrying, but with increased testing, 10 to 11,000 a day in these areas, authorities hope to keep infections in check. With Purnima Murali in Chennai, in New Delhi, Shayani Iyer.
The ICMR has told Bharat Biotech to accelerate the production from the COVID-19 vaccine and has given 15th of August as a clear deadline. We have Sneha Murdani exploring what processes and problems are involved in this process.
Bharat Biotech has been asked to accelerate trials of a COVID-19 vaccine. A letter from ICMR to the company asked for the vaccine to be launched by August 15th. The letter also said non-compliance will be viewed seriously, and the given timelines must be met without any lapse. ICMR confirmed the authenticity of the letter and said it was an internal communication to the company. But experts have questioned the timeline, calling it ambitious, even unreal.
A request would be more about saying that, listen, that, this is an important vaccine trial. We need to follow due processes, but let's all try to collectively work on this and let's try to expedite things while following due processes. It wouldn't sound like the letter we've seen in this case. By putting pressure on the clinical trial sites, that could raise some concerns from an ethics perspective as well.
It's very unclear for me how by August 15th, anything can be ready in terms of a vaccine fit to be rolled into the market, even by their own timeline. And I've also seen their managing director saying somewhere that their best estimate it will be only ready by November or December.
On June 30th, Bharat Biotech became the first Indian pharmaceutical company to get clearances from the Drugs Controller General of India to launch human trials of Covaxin. Bharat Biotech says getting this approval itself was an uphill task.
It all depends on the regulatory and also clinical trial centers, because now that it's locked down, some other places locked down. So I need ethical committee permission, and I need people to volunteers to come to the centers for vaccination, and also they have to be screened. There should be a COVID-free volunteers.
Any other vaccine. In fact, there are many developed countries that are working on a COVID-19 vaccine, but no one has shown this sort of an urgency, this sense of an urgency that is being shown by the Indian Council of Medical Research, with so much pressure being exercised on Bharat Biotech. The trial for this was registered on the 1st of July. There are certain approvals which have not come in just yet. ICMR says that this is only a request. Bharat Biotech has refused to comment on this matter. In New Delhi with video journalist Vikas, Sneha Moldani for CNN News 18.
Some big breaking news coming in. Sources suggest that data shows that more than 40% of Indians dying due to COVID-19 do not have underlying health conditions. The integrated disease surveillance data shows that 43% of deaths among people with no underlying healthcare conditions are taking place. This is a survey done by the Integrated Disease Surveillance Program, and half of the deaths are among senior citizens.
The interesting bit here, Vandana, to begin with, is that the government has not actually shared this data. This has been procured through some sources within the government. Of course, it's the data of the Integrated Disease Surveillance Program, which is an arm of the government looking into COVID-19, involved in contact tracing and other activities vis-a-vis dealing with COVID-19 in the country. The most shocking bit of information here is actually that 43% of the population who have died of COVID-19. So this is an assessment of the data which has got to do with mortalities in the country. It shows that 43% of the population did not have any underlying healthcare conditions, no comorbidities. What does this really mean? This means that the government's own argument that most people who are dying because they are either in the senior citizen age category or underlying healthcare conditions, those with underlying healthcare conditions, that doesn't stand. Their argument then doesn't stand. It's also worrying that there are healthy people who are dying due to COVID-19, otherwise a disease associated with showing deaths or mortality in patients with underlying healthcare conditions of senior citizens. In fact, there is a data associated with how the age group also, in fact, is shown in this particular assessment. It studies data up to the 2nd of July, essentially. And also one startling fact that is coming out of the data is that there are 3 places, Delhi, Maharashtra and UP, 3 states essentially, which are not sharing this sort of a data regularly with the government. Also, a large chunk of people within the productive years are actually succumbing to COVID-19. So that again is a worry.
All right, so this data does show a worrying trend, Sneha, but thank you for bringing us up to speed with the latest. Now, the ILBS hospital in Delhi opened its doors to the country's first plasma bank to fight COVID. Rupeshri Nanda with this report.
We are in the first ever plasma bank in the country. This is the ILBS hospital, and you can see over here there are people who are already recovered from COVID and are currently donating their plasma. This bank has been formed to fill a very essential gap, that is the growing demand for plasma amongst COVID positive persons and the need for the same from COVID recovered patients.
As of now, we have some evidence that it may be useful. But since there are no other drugs and there are no antivirals, no other vaccine, so this appears to be a ray of hope.
The actual procedure takes around between 25 to 45 minutes, depending on the size of the vein of the person.
And I mean, how frequently can a person donate plasma?
Once a person has donated plasma, he can donate after a fortnight, not more than 1000 ml in a month.
Now, News 18's Mission Pani has been keeping the water conversation going in the middle of the COVID-19 pandemic. We got Venaqua water management system is an effective water management solution to managing water usage in large community living areas like apartments and multi-story buildings. Here's the story.
We are more reactive to things than being proactive. Water is a classic case of us reacting to the problem instead of doing something.
Gas, we have an alternative. Electricity, we have an alternative. For water, no alternative. We have to depend on the rain gods. It is about 1 month of rain which we need to manage for the rest of the 11 months or so.
No water, no clothes, no water, no food, no water, no building. So there is an absolute need to start conserving this resource.
If you don't control the demand part of it, however you increase the supply part, is never going to balance it out. So we need to act on it to work on a consumer behavior, change the consumer behavior, bring down the consumption level down. For that, the conservation to happen, we need to manage. If you want to manage, you need to monitor. If you want to monitor, you need to measure.
We project ourselves as a water management platform. Right from your tanker lorry input to your overhead tanks to your final inlet. Everything we manage. You have data about everything from end to end.
This data is helping create a new mindset, and we are enabling it with the data that we have. The other thing we're also looking to build out of this is to gamify the solution. Now imagine in a property we go in and say the top 5 savers will get a free gym membership. Right now there is incentive to start saving water. Consciously what we're trying to do is change people's mindset with the data.
This is almost, I think we installed 4 years back, but our society is almost a 5 years old society. Within a year we installed this. After installation, the number of trucks has come down drastically. It is from 136 to 72, and also the half of the cost. Now we are reduced to 50% so that we are saving for our future.
On that note, it's a wrap on the show. Thank you for watching. But do remember, as